Many areas of the world are experiencing an expanding outbreak of respiratory illness caused by COVID-19. This virus can spread from person to person, and the number of cases detected in many countries is continually growing. As communities within our country, we have to follow the guidelines for responding to COVID-19 outbreak. With us on telephone call is Dr. Amal bint Saif Al Maani, Senior Consultant in Paediatric and Infectious Diseases, Director of Central Department of Infection Prevention and Control at the Ministry of Health. Dr. Amal, can you hear us?
Yes, I can hear you, Abdullah.
Very welcome to our news bulletin here. Now, can you elaborate more about the schools, colleges and universities that have been closed throughout the Sultanate starting from today, which is part of the strategies to reduce the spread of the virus infection? What can you tell us more about it?
Well, thank you, Abdullah, for the interview and focusing on this issue. And let me start by saying that the government of the Sultanate of Oman had been closely monitoring the global situation of COVID-19 outbreak and implementing different measures at each level of the virus spread with the announcement that the outbreak now is a pandemic, which means widespread globally. The Sultanate has gone also to certain serious measures that to be implemented with the package of social distancing and providing measures that would enhance the social distancing aspect. At each stage of our interventions, we have been engaging the community as a partner with us. That would include the measures of school and suspending schooling at the governmental, private schools, and also colleges and universities. This measure operates as a protective measure to enhance the social distancing, as I alluded, and limit the community transmission of the disease. And it should be supplemented with the other measures that would limit also contact and gathering while away from school. The measures that you have alluded into, like restricting travel outside the country, limit the gatherings, whether this is social or other activities, as much as possible. And do not attend crowded places with a lot of people gathering on those places.
And the places like cinema that has been mentioned as well, and theaters, those are not the places actually to go at this particular time. Now, while these students are at home, what are the measures the parents need to take to ensure the prevention of this virus?
Well, I would enforce the practice of everyday preventive actions and reminding everyone in the household of the importance of practicing everyday preventive actions that would help the prevention of the spread of the respiratory illness, such as avoiding close contact with people who are sick. Stay home when you are sick, except to get to, if you need to go to a medical care center. Cover your cough and sneeze with a tissue. Clean frequently touch surfaces and objects daily. And wash your hands and wash your hands as often as you can with soap and water for at least 20 seconds, especially after going to bathrooms, before eating, and after blowing your nose or coughing or sneezing. If soap and water are not readily available, then you can use sanitizer and ensure that it contains at least 60% of alcohol. But please always ensure washing your hands and getting this hygiene practice to your family and your household.
Lovely, Dr. Al Maani. We would like to thank you very much for elaborating to us on the way of preventing the virus. We do hope that the public will adhere to that, and this is definitely the joint responsibility of each and every one of us. Thank you once again, Dr. Al Maani.